All right, well, my name's Dr. Mattern. I'm a chiropractor. I'm going to leave these on because I can't read. I'm at the age where I got to have glasses part of the time. But well, I might take them off. I think I can read most of that stuff. But I got these cards. I ended up being a chiropractor because when I was about 16, 17, I tried to wrestle. And we did this thing called the guillotine, which is about as painful as it sounds. But we did that for about an hour in wrestling, and I looked like a question mark the next day. So my mom was a nurse, and she said, well, just do these drugs. And they didn't work, so I'm like trying to stack myself up and do this traction and all this stuff and trying to wrestle and do this high school stuff. And my dad was a little guy, and he was a millwright, blue-collar kind of job, and he was the little guy, so he had to take these wrenches and stuff and go inside these machines to fix them from the inside out. So he'd get twisted around and bang his head or do whatever, and he'd come home looking like me, but he'd go to see the chiropractor, and he says, well, come on down, we'll see this guy. So, and he helped me. I mean, he helped me when nothing else would really do it. So that's when I really got interested in chiropractic. So I didn't know what I was going to do. When I was your age, I was thinking, med tech. I didn't even know what med tech was. But I had a scholarship. I had to declare a major. So I was doing that for a while. And finally I said, well, I'm going to see what med tech does. So I went down to the basement. And I go, where's med tech? I went to the local hospital. And they go, well, they're in the basement. So there's no windows. So you work with whatever comes out of the body for 30 years. And then when you decide not to do that, you get a desk job. So I decided I didn't want to do that. So I went back and I started shadowing a couple of these chiropractors, and it was interesting, and I just pulled the trigger. I got the prereqs that I needed to get out of the undergrad. And I went to Palmer College of Chiropractic, and I graduated with a BS in General Science and a doctorate in chiropractic way back in 1989. So I did the math officially. I've been a chiropractor about half my life now. So we got some questions. I've done this before. I get off on tangents and stuff, and you guys just get glazed over. So this is a little bit more pertinent. So we'll just go through your questions, and I'll probably still get off on a tangent, but it might be a little bit more interesting. Can I prescribe? No. So chiropractic is a healthcare profession that does not do allopathic care. So allopathy is basically medicine. They treat with the opposites. So you get a rapid heartbeat, what do you guys do? You give a drug to slow it down. Okay, so by definition, they're trying to treat with opposites. So chiropractic deals with what they call the innate potential of the body. That's the homeostasis, that's the healing potential. 100 years ago, they didn't have a word for it. Chiropractic had to actually invent words to describe what we're trying to do. And, a long time ago, there was a big issue with some of this stuff because our profession was new. It started off with a guy named D.D. Palmer. He was self-educated, and he was educated by his father. He, I think it was Canadian, and he ran he had a practice where he had magnetic healing. So even before chiropractic, he was a healer out in Davenport, Iowa. And the story goes that he had this janitor that was sweeping the floor, and he was leaving. And he says, good night, Harvey. And Harvey didn't hear him because he was deaf. And he decided to check Harvey out, and he looked him over, and he had a lump on his neck. So he talked Harvey into laying down, and quote unquote, he racked a vertebra into position, and Harvey got his hearing back. So that was how all this started back in 1895. But at that time, that was wild, wild west of people were doing leeches, and cocaine was a nice prescription. It really gets you going through the day, and all these elixirs and everything. But that's how chiropractic started. But his son ended up running the thing. His name was B.J. Palmer, and they kind of turned it into an institution. But there's the Kellogg's, and there's these natural healers, and people would check in, they'd be stressed out, and they'd go into some community thing where they just basically they detox. I mean, that's what we call it today, and they do physical therapy. So B.J. Palmer, in his height and glory, he had the largest physical therapy department west of the Mississippi, around turn of the century. But it got pretty political, and there was a lot of stuff going on. So medicine was jumping and getting big. Carnegies and Rockefellers and stuff were giving grants and commissions to build university educational places, but they wanted to graduate students who would prescribe medications because they owned the rights to the medications, they owned the rights to the Dows and the DuPonts and everybody that would do that. So that's how allopathy really got its start. But they saw chiropractic and naturopaths and everybody that did anything alternative and unusual or off the beaten path. They would say, we don't want this because it doesn't go into our system. It's not to our financial gain. So the chiropractors at the turn of the century, they were the number one target. So in the 60s or early 70s, it was just grossly, manifest because younger chiropractors, my benefactors, the old guys that were in my profession, they spent time in jail for practicing medicine without a license. That was the deal. But, you know, the AMA is the big juggernaut. They decide how things work in North America. And we ended up, a small group of chiropractors actually took them to court, and we sued them, and we kept winning. And we took it all the way up to the Supreme Court. I think it was 1987, and they were found guilty of attempting to contain and eliminate a competing healthcare profession. And it was choreographed. It was orchestrated from the top down. And we really should have sued them for a couple billion, because we don't really get a lot of money federally to investigate what we do. But that's been the big rift with chiropractic for a long, long time. But after the barrier was down, we said, you know, okay, just let us be, you know, let us dialogue with you guys, and that's opened up a lot of doors, you know, towards the younger guys. Now with the older guys, they still got that mentality, and they're just going to retire or die or something. But it has changed a little bit over the time. So that's kind of the quick history off of that. So off of, can you prescribe? No, but there's reasons why we don't. So we intentionally don't do that, because you guys know more about the drugs than I do. So, and they screw you up. So there's a move for some chiropractors to have limitation prescription rights, but that's just a whole mess, because you don't want to mess with that, you know, because if you can tell her, I got a headache, well, here, take some Tylenol. I can't do that. I've just violated my scope of practice law. But if I don't have that doctorate, I could tell you. But I just maintain that. So it gets kind of tricky with what you're trying to treat or what you're trying to tell people. But we don't have prescription rights, and we choose not to right now as a profession. So that gives you, well, here's this. What education, this is the next question, is required to be a chiropractor? Well, basically, I sat through all the ologies that you guys are probably sitting through in undergrad. So you got whatever. I mean, you got your biology, you got to pick or whatever, but I sat through and suffered through the same chemistry, the same organics, the same inorganic, the same physics, all that stuff. So I'm just like, what are you doing? I'm pre-dent, I'm pre-med, I'm pre-pharmacy, I was the one oddball, pre-chiropractic. So, but when you get to chiropractic school, basically you still have, it's like pre-med stuff. You go through all this stuff. And I thought it was hard. I mean, it was hard. I carried about 26 hours. I graduated when I was 25. So, but I looked, and I remember way back when it says the top 8 or top 10 toughest schools in North America, and they were all law schools, and then it had said Palmer College of Chiropractic was number 9. I couldn't believe it. It was crazy. But we sat in a classroom. It was a big theater. It was like 110 people in my class. Professors came to us. I mean, it was brutal. I mean, we have myology, and then you stand up and stretch, then you have splanknology, and then you stand up and stretch, and then you have visceral pathology. You stand up and stretch, and you go to lunch, then you come back and you got gross anatomy and microbiology or whatever. So, you know, it's about a year of just all the ologies and everything, and you got another year of that, and then you start getting into clinical stuff. So when we're getting into clinical stuff, we were doing differential diagnosis, we were doing hands-on palpation, and, you know, basically physical evaluation from a chiropractic point of view. Medically, they're doing all the toxicology and the pharmacology and all the other ologies. But we don't have a big, grand, round thing where we do 2 years in a VA hospital and do all that. So that's one of the deficits, I think, in my profession, because you just don't see such a huge range of what you would if you're a medical doctor. But we don't treat those emergency situations. So far, it's been okay. So, but altogether, I've had 6 years. Some schools now, you got to go 8 years to be a chiropractor. And my butt was in a chair for 4,400 hours, and that's enough for me. So you have to pass 2 state boards when I had to do it, and I had to pass a state board for physiology, for physical therapy in Indiana. And it all varies. So if you have a nice state, you're going to have tough laws, because there's enough chiropractors in there, so the guys that are the powers that be make it more difficult. So if you want to practice in Denver, you can probably plan on taking a board 2 or 3 times to get in. So it wasn't that hard in Indiana, because, hey, it's Indiana. Okay, but I maintained another license for years down in South Carolina, but if we have a nuclear meltdown from something over in Illinois, I'm going to have to stay and tough it out, I guess, in Indiana. So this next question is, what kind of ailments are you able to treat using chiropractic medicine? You know, what is the main patient demographic? Well, chiropractic medicine, as I've alluded to, is kind of an oxymoron. Chiropractic, they've always fought to be separate and distinct. You know, we've chosen to do that. There's another healing profession there called osteopaths. They kind of bought in with allopathy, and now they're really not even DOs aren't a separate and distinct profession. They used to manipulate, they used to do spinal corrections and stuff, but a lot of them don't. They're just basically, a lot of them are just needle jockeys. I mean, you go to a DO school, if they do anything spinal, it's just going to be cortisone, trigger point injections and stuff like that. Very few of them manipulate. And the word manipulate, that's what the insurance health, that's basically what they've kind of pigeonholed us in. This spinal manipulation is the word that they use. So if I want to get paid by a third party or an insurance company, the word that I use is spinal manipulation. But I don't like the word. I mean, if I got a car that doesn't run right and it's a carburetor, would you want to have your car adjusted or manipulated? So chiropractors like to use the word adjust, okay? It means to set right. Manipulate means you just fiddle around with it, So it's just like it's just terminology, but somebody else has used these terms and they've kind of put them on my profession. But, the medicine part of it, medicine is allopathy. You're treating with drugs. So what do drugs do? Drugs stop a function. So they take sick people and they keep them from dying, hopefully. So that's really what drugs are supposed to do. But drugs work by poisoning enzyme systems. So sometimes it's needed, but if you're in a hospital setting, you're trying to keep that guy's blood pH from 7.35 to 7.45, or they're dead or in a diabetic coma. Everybody walks into my office, so I don't have to worry about that stuff. So most of the time, so that's the difference, because we've got great emergency. We got the world's best emergency medicine, but it's just totally messed up because it's so expensive that they're doing the overhaul now, and it's probably still not going to work. But I saw a guy yesterday, and he's in. And he says, you fixed that hip, and they wanted me to do this and this and this. And he says, that was going to be $4,000. He said, remember last year they wanted you to do that and that? And I said, well, and that was going to be another $12,000. And he's probably wrapped up $300 with me. Okay, so in the medical system, it's just crazy. But they've done studies. We get a hard time with Medicare because they say we overutilize Medicare. But you get somebody at 72, she takes her blood pressure pill how many times? Every day. Okay, so if we see them more than 6 or 12 times, we start getting heat from the federal government saying, well, you're overutilizing. But they did a study, and they said for chiropractic patients, basically every time I see somebody that's on Medicare, I save the system $465. Because if they don't come and see me, they go through the medical route, and the first thing you got to do is like, well, we don't know what it is. Let's do an MRI. Let's do a SPECT scan. Let's do whatever. And somewhere in between, somebody gets sick, somebody gets staph, somebody gets strep, somebody has a negative reaction with a dye study or whatever. But if you do the math, it's just crazy how much money chiropractic could save the whole system if we were to actually include it. But right now, we're not that much. Most guys are like me. We're on the outside looking in, but we still dialogue with everybody. We still send out reports. We still coordinate things. But a lot of it's just controlled by, the powers that be that are bigger than me. They're either hospitals or they're either carriers or they're either, federal programs. So ailments with chiropractic, main patient demographic is people with a spine. Infants kind of are freaky because they got all sorts of, physiologic stuff. They're just kind of a bag of cartilage and, soft tissue. So most kids, though, if you work with a younger child, they respond well because they haven't been messed up for 30 years. But they do have stuff that I just don't really feel comfortable taking care of a newborn. Now, some people will. Some female chiropractors especially love kids, and they get great results with stuff like autonomic overstimulation, or they have had birth trauma, or they've had all these issues with colic or failure to thrive or whatever. And a lot of it's just based on the nervous system. So if you can decompress the nervous system with very gentle applications of force through the neck or the sacral area, a lot of times these kids respond dramatically and fast because they don't have 40 years of degenerative issues. So that is probably a demographic I'd avoid. I like people your age because they're great. They respond good too. They understand what I'm trying to language, but I'd say the median age, I probably have 60% female. Most people do across the board. And then, I see a lot of people that have just been beat up. They got a blue-collar job, they got a bad back, they got a bad neck, they got a bad shoulder. I keep them up and running, and that's what usually helps. So I suppose it would be female 45 would be the median demographic, but I've got a 96-year-old, and she's doing fine, and I saw a 6-year-old yesterday, so that's the spread. So basically, if they can walk in and they got a spine, I'll probably see what I can do to help them. All right. Another question. This is, what effect does cracking your knuckles or back have? So that pop, okay, is not probably an adjustment. I call that a manipulation. But when you do that, what you do is you're gapping that joint and you're extending it through the paraphysiologic joint space. Now, if I kept cranking on it, by definition, I would do damage. but that gets into some pretty hardcore articular neurology. But basically what chiropractors in large part do when they do joint manipulation and stuff like that, we're professional joint mechanoreceptor stimulators, okay? So joint mechanoreceptors, muscle spindle cells, Golgi tendon organs. Does that ring a bell? You guys suffer through physiology? So, that's the stuff that we're trying to do in the periphery or in the joints, and they're either extremity joints or they're spinal joints. But if you take a joint that's hypomobile, typically we work with hypomobile, so you don't want to be cranking on a hypermobile. You want to brace it and let it heal. But if you've got a point that's stuck, you put a vector or a force in it by hand or with an instrument, and you try to cavitate that joint. So when you cavitate that joint, it's like opening up a pop. You get basically a gas under pressure. That's that sound, that's that popping that you hear. So, but you've extended that joint through its normal, its maximum paraphysiologic zone. So I can't do anything with that knuckle for a while. In an hour, I'll probably be able to do that again. But when you do that, you fire off those neuromechanoreceptors. So that runs back to the spinal cord through the dorsal root ganglion, and it probably goes through substantia gelatinosa number dorsal lamina 7, and it has an interneuron, and then it crosses somewhere there, and it will probably hit the lateral spinal thalamic tract, and it goes up through the thalamus, and it gets rerouted through the cortex, and then it does something. But it basically, at that interneuron pool into the spinal cord, it basically upregulates the gait theory or the gait pain mechanism. So that's really hardcore neurology, and I probably screwed it all up. But basically, you got a transmission of either pain receptors or these afferent receptors coming in that are fired off by the joint mechanoreceptors. Those travel faster, so they can overwhelm the gate of the pain, so you basically shut it off. So that's one way we do it. And the other way, if it's something's inflammatory, then you got all the classic stuff of inflammation. You got the rubor, dolor, calor. Remember all that stuff? Who did that? Galen? Or who was the first guy that did that? Some Greek guy. He would basically coat people with clay, set them out in the sun, and what dried fastest was where they had the inflammation, so that's what they would look at. So that's 2,000 years of basically inflammatory treatment. But when you pop a joint, just understand what we're trying to do is basically, you're trying to fire off joint mechanoreceptors, and that's usually what happens. Now, there's different things that will happen within the joint. Sometimes you have like a nipped synovial fringe in the lumbar spine, or you have some other things, or the uncovertebral joints in the neck. But the neck is richly innervated with these JMRs. But basically, you're influencing high brain centers to abort some of these pain receptive phenomenon, improve range of motion, and on a bigger global level, you're decongesting tissue, you're pumping lymphatics, you're doing all this stuff, and all that's helpful. All that's manual modalities that's proven to be therapeutic. So I think I covered that. So the pop is just understand when you're not damaging the joint. So I'm not a professional joint damager. I'm a professional joint stimulator. So you're trying to upregulate that pathway that drives it, and most of it occurs at the level of the spinal cord. So how many patients do I see daily? I don't know, probably 20, 25, 28. Big day would be over 30. But, I see people probably, I got a window. It's about 15, 20-minute office evaluation. It takes more time to work somebody up. But, it just depends on what somebody comes in with. So, you got to slow down on somebody where you think you have some pathology or nobody's checked them. I'll see somebody from Otterburn. They've been on the back 80 for forever, and they come to see me. I'm the only guy that ever sees them, so I slow down on those guys because most people I see, they decide to come to me because nothing else has helped. They go, well, I've done this, I've done this, I've done this. That was great because I say, well, have you done this? And they go, well, no. Then I know I can probably do something with them. And that's nice because they've already spent their money elsewhere, and we know that we're not dealing with colon cancer or something else because they've done all the money, all the diagnostics, so I can just work on trying to improve physiology. So that's kind of nice with me too, because what we try to do is what I'm boiling a lot of stuff down to is just basically stress. If you can look at stress, that's basically Hans Selye. You go way back into, what Psychology 101, it's the general adaptive stress syndrome. So what do I really treat is I'm trying to influence the body's ability to balance itself, and that's called what? Homeostasis, right? So we're trying to influence homeostasis, and we're trying to see what the source of stress is. So I break that up into structural. That's classic chiropractic. So first thing I do is I stand them up. I want to look at their posture. I say, what shoulders drop down? What's their hips look like? The big one is their feet, okay? If they've got flat feet, if they got altered pedal mechanics, They're going to screw something up upstream. They're going to blow out a knee. They're going to have chronic hip issues. They're going to have a disc issue. They're going to have chronic migraines, whatever. So I always want to try to stabilize the pedal mechanics. So you win or lose your fight against gravity. Well, you always lose, but the idea is to lose slow. But with gravity, if you're not putting your foot down properly on the ground, that's out of the gate, you're going to lose against gravity a lot quicker than what you would. So I always try to stabilize pedal mechanics if it looks like they need it. And then I'm trying to balance out the hip, the pelvis, that's center mass. If you don't have your center mass squared away, you're going to have problems because center mass is what everything works across your hips. So if you try to set a pick in basketball, you try to swing a golf club, you try to do anything functional in your work environment, if you're out of balance to the pelvis, it's going to go up in your back. Your back's going to compensate, and it'll start to fail. You end up with disc and facet syndromes and whatever. So that's the other big one I'm looking at. And a huge one with your demographic is this head-forward posture. Okay, this is great because I drive through campus and I see all my future patients. All you guys look like Gollum out there walking to class. But that's a big one. I mean, you guys can stand up, just sit up here and look left and right with your head upright, okay? And the people, you got pretty good range of motion. Now translate your head forward an inch or two. All right, that 10-pound head now weighs about 30 pounds mechanically. Try to rotate your neck. You can't, okay? This is the people I see. They're out here already. So most of my day, I'm trying to reel everybody back and get their head squared up over their shoulders. And if you don't do that, it's just a law. It's Sherrington's law of reciprocal inhibition because everybody gets packed up through the pecs. All this stuff rolls you forward. And if you've got a tight group of muscles, by definition, the agonist muscles, the antagonist muscles are going to be shut off. That's your rhomboids, that's your cuff, that's everything else. So you get all these people, they're rounding their shoulders, they're pitching their head forward. A lot of them are so screwed up, you put your hands on their shoulder blade, and they can't even auto-contract. They can't even override that mechanism. You got to teach them how to really activate those muscles again. And that's just straight, easy exercise. You just got them to do it to basically tighten up the rotor cuff muscles, the interscapular muscles and stuff, and you get them to do reverse flies and some things, and they can hold that head upright. But that's all this dental mechanism of TMJs and migraines and thoracic outlet syndromes and just about every shoulder syndrome you can look at, it's all going to start with a head-forward posture. And it's this epidemic. I mean, it's great because it's job security for me. But, you guys got to start setting upright and trying to do something to fire off all these shoulder blade muscles in the back, because that's one thing that most people need. All right, moving on. It says, how would you differentiate between a physical therapist and a chiropractor? When would you refer a patient to someone else? Well, I see people, and I want to see somebody improve pretty quick. If I haven't turned something in 3 or 4 times I've worked with them, I'm looking for something I'm missing, because there's always something if they don't respond fairly quick, or if you just see something weird. I don't know what it is anymore. I take a picture and I see something weird with an X-ray. I don't know if it's a unicameral bone cyst or an aneurysmal bone cyst. I know it's not right, so they're going to go somewhere else and let them diagnose it and figure it out. And if they say, oh, it's nothing, then I'll come back and I'll do my deal. But if somebody's not getting better, I mean, I try to get them out and get another workup and get somebody else out on the limb with me, and it could be an endocrinologist, it could be their GP, it could be whatever. And some of it that's just dictated by the carrier. If I want to order an MRI, I can't even do that anymore for a Medicare patient, but I can do it for somebody like Anthem, but it's a big pain, and I don't like to do it. They accuse chiropractors of over-diagnosing. The biggest guys that do that is the medical doctors. They just say, well, we'll hit everything. I'll see you in a week, and we'll just give you $20,000 worth of differentials, and we'll see. Then it's negative. Then they just give them a pill, and then they come to see me. But they've done all that, and then I can actually try to get back to the structural source of a lot of that. But it's a pain to try to order an MRI because you end up, you got to dial ask a nurse, and it takes you 20 minutes to get authorization. You got to get a certification number, and then you got to write it out, and then you got to send it over, and then you got to interpret it. And if it's a big blown out disc, I'm going to send them out to a neurosurgical consult anyway, or at least pain management. So a lot of the bad ones like that, I'm always sharing them. If I'm not sharing them already, I'm sharing them with somebody else. But it's difficult sometimes because right now we're in this technology thing where if you're in a hospital, they got their software, it doesn't work with my software, so you got to just spit out a note, that's typed, and you got to send it or fax it, and it gets lost or gets buried in the record, or sometimes if I have to send them out, I assume I have to punt on that guy. They'll do something, but the guy may be back. But it's kind of difficult to work with the medical profession now because they still are kind of quasi, they don't like chiropractors because really they don't know what we do sometimes, and they just go, well, I'll just send them to PT. But PT is a lot of like what I do. So that's basically, if you want to think of chiropractic, the stuff that we do is probably as close as we can would be physical therapy if it's straight structural stuff. Or massage, because I haven't got, if somebody wants to call me a massage therapist, I'm fine with it because, massage does a ton of stuff. So you look at you go PubMed and you look at research on what massage does with upregulating the immune system and, de-stressing somebody and improve, hemodynamics and everything. There's research with all that stuff. So, but, with physical therapist versus chiropractor, I mean, a lot of times I work, it says, well, you're doing this shoulder stuff with the PT, I'm going to stick to the spine so we're not doubling up on stuff, and I'll try to get a letter out or whatever with the PT, and that's fine. So, and that's actually good because it upregulates how fast you can get some of these people better, or you get them to comply, or you get both people yelling at them, they'll dumb you up and do what you're supposed to, what you tell them to do sometimes when they wouldn't if I just told them. So, this one here, is there any recommended do's and don'ts for something therapy? And the other one says, what are the emerging technologies in the field and paradigms of treatment? With me, I don't know if it's emerging. It's the same old stuff. I mean, it's one of the things I try to do, the first thing I said is structure. And we're talking about stress. So there's a structural stress. It's called gravity. Pushes you towards the center of the earth at 33.5 pounds per square inch all the time. Doesn't matter. You can be someplace nice. You can be someplace with rotten weather. Gravity is gravity. So the idea is to oppose gravity as efficiently as you can for your whole life. That's the structural thing I try to look at. The other one is nutritional, because I can do nutritional intervention, and medically they don't know how to do any of it, or they don't care. And they just assume that your digestive process works when a lot of times it doesn't. So that is a huge window into stuff that I can influence people with, because I really don't want to treat somebody and say, chiropractically, I'm trying to help you with MS or whatever problem, but I see people with all these cofactor diagnoses all the time. I'm not going to try to treat somebody for MS, but I can help somebody with MS dramatically, or Sjögren's syndrome, or lupus, or whatever endocrine issue you want to name, if you still improve some of the basic foundational things like trying to balance out their pH of their body, trying to help improve their digestion, try to help improve their, give them coping strategies for stress reduction, give them exercise to improve their physiology with gravity. It's just simple stuff. It's not emergency care. So the emergency, there's always some new thing. I mean, if you watch, what's the new thing now with health and fitness? What's the new thing? It used to be like Tybo. There's always some, CrossFit. CrossFit's the new thing, right? You guys heard CrossFit? Is that a big thing now? So that's going to fade away. It'll be something else in 2 years. But it's always something else about 2 years. So it just runs through. But emerging technologies, there's some stuff that's kind of cool. Lasers, cold lasers are pretty neat because they upregulate ATP. If you zap somebody with some stem or something, sometimes you actually slow down the ATP synthesis, so it actually slows down recovery. But there's other techniques, and I like taping. There's different types of tape. I use kinesio tape. There's leuco tape. There's all these different tapes, but you're just basically trying to reestablish normal engrams of structure and neurology patterns. But most people I see, they're so screwed up, I'm just trying to move stuff and just try to get them to stand up right. And I'm not working with very many high-level athletes, so I don't have to do a lot of functional evaluation, because I got plenty to work on just looking at them just structurally without even moving. So the other big one is nutrition. So the biggest window that I see that I've looked at, number one, is enzymes, because we don't get enzymes the way we used to. So the only thing that does work in your body are enzymes. By definition, they do work. So have you guys got the thing with the big biochemistry, the huge thing that shows you all the biochem thing? It's from a farm, or it's from a drug thing. That's great. Was it Roche, LaRoche, or somebody? They're out of Indy. Am I saying it right? Roche? But that's awesome. I mean, I got the thing laminated. And you look at it, everything in blue is an enzyme. And those are the metabolic enzymes. So you're driving everything with an enzyme. So everything we eat now is packaged. All the GMOs, everything that's new, that same tomato that they've been raising in the San Joaquin Valley for 85 years that they pick green and they put in some storage to send it to Maine, they intentionally knock down the enzymes. So what most people really dramatically need are enzymes. So that's one of my big things that I've been trying to get into lately, because nobody does it, nobody knows it. Chiropractors used to be big into the stuff with basically, probiotics. That was a crazy thing, 10 years ago. Now you can't watch an hour of TV and they're saying, oh, well, you got to do this probiotic for stomach aches, or all this stuff. They understand now that the intestinal milieu is pretty important, in the lower bowel and everything. That screws people up. Now it's a huge money-making thing, and I don't even bother with it now because they can go down to Walgreens and get something cheaper than what I can give it to them. But we were on the cutting edge of that with naturopaths for forever, until somebody really decided to study it. But what I like, one of the things I want to try to get into, I'll be a structural chiropractor as long as I can hold up physically and still do it myself. But I do like enzymes because that's nice, because it helps a lot of the stuff that people, if they don't have a disease process, if they're not in a hospital of some end stage whatever, then they're screwed up. They're inflamed. So basically you're looking at basically anti-inflammatories, antacids, and digestive laxatives. If you look and what you guys are going across over the counter, those are the big three things. If you improve digestion, that's your huge market on any one of those. So if I know how to do enzymes with people, that's a big window into what I want to try to get into when I get older, because it's not physically challenging on me, and I basically can sit down and do it, and I could even consult do it and do it from afar. If I wanted to try to do that, I could do it online. But enzymes are nice because the way that I try to do it is I do a symptom survey, a big health questionnaire, and you're basically trying to stack symptoms where you think they're going to go. Well, is this endocrine? Is this upper GI? Is this lower GI? Is this a liver toxicity thing? Does this look like protein issue? You're not metabolizing carbohydrates. You got issues with lipids. You stack them up that way. You do a physiologic assessment. So basically there's points in the body that I'm going to push on, or I have somebody else push on. And if they're sore, then that basically means you have something going on. And the rationale that works behind that is pretty neat, because you have a somatovisceral response, you have a visceral somatic response. Because I think it's day 13 of fetal development, you've got the mesoderm, and it gets kind of smeared in with the endoderm, so you get this stretch response to the autonomic nervous system. So your muscle contraction that you see through the abdominal wall is linked up with an organ system. So it's not like a switchboard exactly in your basement. It's not this one blown circuit, but you can get some pretty good information on what systems are challenged with that. And then I try to double that up with the 24-hour urinalysis, because urine is basically blood that's yellow. So you can kind of look and see what the extracellular fluid is doing. So you live and die at the level of the cell. So what you want to try to do is basically upregulate the nutrients that are going into the cell, and you want to make it more efficient for those people to get rid of the stuff. I also use a bioimpedance analysis, and that tells me basically one reason I want to use it is I want to see what I'm doing with them at the extracellular level of the fluid. So if I'm working with somebody and they come back and I do it again, they've picked up 2 liters of extracellular fluid, something's wrong. So we want to have that level go down, because the solution to pollution is dilution. So if you're not fixing that, then you're missing something. So you got to go back in and see if they've got cancer, they got some weird leukemia or something. I don't have any diagnostics other than that in my office. So if something looks weird, I get them out. But just remember that the solution to pollution is dilution. And we live and die at the level of the cell, the phospholipid bilayer, and that's a pretty important deal there, because that's by definition it's made of lipids, right? What do most people in middle America eat? French fried, trans fatty acid grease. They're basically making their cells out of French fry grease. So I try to get them on to, eat the fish oil, the docosahexaenoic acid, all that stuff. We can do some of that, but with the emphasis I want to really try to do as I get older will be the acid-base chemistry, the balancing out, just basically a stress response. It's fundamental. Everybody knows it. It's well accepted. Nobody's going to, say Hans Selye was wrong. But enzymes are huge, and it's underappreciated, and it's only going to get worse as we package more and more stuff. So enzymes are a big deal right now, because I just took one of the seminars. I liked it. It's stuff I forgot about. It makes sense. I'm going to try to learn that as well as I can. So, and the other one's the emotional. That's the other big thing. So basically, chiropractic at the turn of the century, you go, well, D.D. Palmer says, well, what do we work on? It says, well, how do people get sick? What's all sorts of disease? And he said it was timing. What's just basically now they call that, what is it? It begins with H. H, I said it before. The balance of the body, homeostasis, that's timing. So if timing's bad, you got a rapid heartbeat, you got diarrhea, you're doing something out of sync. You've upregulated your adrenals, you're frying your adrenals out of wherever. That's timing. And then toxicity, heavy metals, a toxic bowel, autotoxicity, all this stuff, that's another one. and then autosuggestion, and then trauma. His point of autosuggestion was that little guy that talks in the back of your head all the time, says you're an idiot. He says that causes a lot of stress, and it does. I mean, they got a whole branch of psychology and psychiatry for it. I don't necessarily deal with that because I have a hard enough time with my own head. But I acknowledge it with people, and I say, well, this is structure, this is nutrition, and you got some issues to work on. If I got a 45-year-old female in a bad marriage and she's got her parents moved in and she's got an autistic kid, she's got some stuff, and I'm not going to be able to help all of it, but I understand where at least some of it's coming from. So those are the big three, and for the older females, they like it when I say, well, your problem's men, okay? So men is mechanical, it's emotional, and it's nutritional. And if I can help in any of those windows, I'm going to improve them. I may not fix them, because basically, if you can hold them at base, then you're doing some good. But you can usually help somebody with trying to look at those three legs of that stool. So you just got to figure out where they're having trouble with and try to stabilize them as well as you can. So I think we covered that question. What do I not like about my job? Medicare. All right. Okay. Have you ever seen a chiropractor myself? Yeah, I see a chiropractor a couple times a month. I got a buddy of mine. We've worked on each other probably 20 years. He hurt his back. He was a chiropractor. He did something stupid, but he's a 100-mile runner kind of guy, and he's my age. But he likes doing that. But his wife's a chiropractor too, and he wouldn't do what she wanted him to, so she fired him. And he's like, "You can't fire me." She says, "You got to go see Jim because you won't do what." So that was good for me. So now we work on each other. We've done that for 20 years. And I have a massage therapist in my office, so I do that too. My brother's a massage therapist, so I do body work with those guys. How am I doing on time? Okay. All right. So we'll go through some more here. Was there a question on anybody? I'll take a question. Yeah? Okay. All right. How many patients? Okay, we did that. Weekly basis, I guess I'm seeing 25 patients a day. You can call it that. Hopefully I get a new patient every other day or so just to keep it interesting. Collaborate with medical doctors. Yeah, I don't get a lot of feedback, but I know the guys, and I try to get them out. When I smell a rat, I try to get somebody else out on the limb with me. I say, this is more complicated than I want to mess with by myself. And I'll tell you a story yesterday because I saw this younger lady. I've seen her since she's 16. She's a soccer mom now, but she picked up a lot of weight. She has bad scoliosis, and she comes in to see me. I haven't seen her for like 2 years, and she says, "Well, they shined a light in my eye, and they wanted to get a PET scan." So I was like, "Well, what did they say was wrong?" She goes, "I don't know." So now I got somebody, they shine a light in my eye. That's like, well, you got an upper motor neuron lesion, you got a brain tumor. What are they looking around for? So, but I worked her up. I mean, you got Perla, your pupils are round, equal to light and accommodation. Stand up straight, close your eyes. She didn't fall over. She had a negative Romberg, so her cerebellum's probably functional. I check her deep tendon reflex. It looks like it's okay. There's no hyperreflexia, so I've eliminated MS, a lot of brain issues, a lot of stuff I don't want to mess with. So I worked her up and I adjusted her. But I questioned her and stuff too, and basically she's been doing some crazy detox. So she's eating healthy, but she's not used to it. And what I think she's really doing is she's been eating so well, she's probably what they call a pathologic detoxifier. So how many people suffer through the cytochrome P450 system here? All you guys know that a lot better than me. But the pathologic detoxifiers, they upregulate phase 1, they hit it real good, and they get a bottleneck on the phase 2. So when they're trying to conjugate or deaminate or desulfate or whatever, to basically hook on the water to that and get rid of it, they got a bottleneck. They back it up and they get sick. So I said, that stuff's great, but you got to slow down. I adjusted her. She was tons better, and I saved her probably $6,000 on evaluation. But I told her to get back there because I don't know what they're looking at. You might be a diabetic, and I didn't bother to do all the other vitals, but they might be looking at AV nicking or cotton wool appearance if you look in the eye. I don't dilate the eyes. I'm looking through a little keyhole anyway, and I hate to do it because you got to breathe on somebody, and they got to breathe on me, and it's just a pain. But she was better, okay? But you got to look for things like that because when you hear hoofbeats, I like to take care of horses, okay? Every once in a while they try to sneak in a zebra, okay? They sound just alike. These hoofbeats sound pretty close. So you got to do some evaluation and protocols to figure out, this is a zebra. I don't want to mess with you guys. You guys go over here. This is disease. This is pathology. This is not worth my stress to deal with you. And if they do all their deal, come back, okay, because I want to work on improving your physiology. I'm not going to keep you here at this disease level right on the edge, of the dagger where you're going to live or die if you take your medications and they keep it right. I don't want to mess with that stuff. So that's where, medicine comes in. But it's sad because there's so many people right on that edge. They don't have to be that way. You could back them up. You get them to quit eating, what they eat, 3 Big Macs and 6 Mountain Dews a day. That's crazy. And it's just the stuff you see. It's like I read the Time article 2 times ago, the Time article about cancer, and they say, well, you're basically screwed. You're going to get it or you won't get it. It's just luck of the draw. It's just your stem cells. Like, how crazy is that? I mean, you're telling me that you can put that guy in a tanning bed with a 5th of Jack Daniels and bacon and do that for 3 years in a row, and you take 5,000 of those guys, and they're not going to have more cancer than somebody that eats healthy vegetables in 20 years. And it's like, that's not even common sense. But, it's like I wanted to follow up on the article because they say, well, we need more intervention and we need more diagnosis and earlier intervention. I'm thinking, who funded this? Like an MRI manufacturing company or something? But, that's crazy. So there's plenty of alternative and natural things you can do to just basically balance their physiology out. So you don't have to end up with the drugs because drugs by definition are toxic to enzymes and they capture that body and they hold you in that position, which is what some people absolutely need because if they're not on their drug, boom, they fall over the cliff. They're dead. But basically you're locking up that physiology where you can't do anything. I don't mess with somebody on Coumadin. I mean, I don't do any nutritional therapy on them, and I'm really careful because if something goes wrong, they're going to blame me. So I go really easy on somebody with anticoagulants and stuff because they were so locked in, they can't budge either. Even if you try to do something, they try to get, and they say, well, what did he tell you to eat? It's like, he didn't tell me anything. So he says, you can eat 3 Big Macs a day, and they got no problem with that. And they go, yeah. They like it because they know that I don't have to mess with my levels anymore because I'm stable. I'm just screwed up all constantly, but I'm stable. So when you start doing stuff, if somebody actually decides to say, hey, I'm getting old, I feel terrible, I'm going to exercise, I'm going to eat right, I'm going to drink healthy water, I'm going to do this and this and this. If they're on a bunch of medications, I got to send them back in, and sometimes they'll get flack because it's like, hey, you're just on a kick. You're going to fall off of it. In 30 days, you'll be back to doing the same old stuff you did. And it's really hard to back somebody off if they're on a bunch of drugs because they're locked in, okay? And they've worked hard to get them locked in with those pathways. So if somebody starts getting healthy, the drug gets more and more toxic because you're designed to keep them in that position. So when somebody tries to get, back in shape or doing something or actually get healthier and they're on a ton of drugs, it's hard. And what's this? I mean, there's people there on 11 prescriptions. I mean, it's crazy. 4 of them were from to counter the other ones that are creating side effects. And I think it's statistically, if you're on more than 6, it's impossible to not have a drug side effect, even if they're all matched up. That's one of the stupid things I had to pony up for is a $400 software program for Medicare where I got to type in all their drugs, then I got to ask the internet, basically, are any of these toxic? And the software program is supposed to tell me. I don't care. I'm not going to mess with any of them anyway. I'm not going to even touch them. I just have to write them down and record them for Medicare. But it's a big pain because somebody else like you guys know more than I know. I don't know anything about it. I say, well, ask who's your primary? Ask your pharmacist. You ask the pharmacist because they actually know because the primary only knows the 24 that the drug reps taught them. So that's the things you got to know. But I always bump them back to the pharmacist. But you just understand when you're locking somebody's physiology up, you're locking them up and it keeps them from dying, but it's really hard for them to get better too. All right. I've thumbed through, I think, some of the same ones here. Big role does placebo effect play with your patients? I don't know if it's placebo or not. I mean, how much of a placebo effect is a knee surgery? That's a pretty big placebo effect. So, somebody comes in, they go, hey, I got 3 holes in my knee. I got to get getting better. That's a big placebo effect too. But I'll take placebo. I like it. It's proven. Those same people where you're just doing a lot of hand holding, and it's like, well, that's probably all I'm going to do. She's 82. She's not getting better. How far? Don't walk towards the light, Alice. You're doing fine. Okay, that's all you can do on some people. But one of the other things with enzymes, it's nice because you do certain things. Basically, the systems are working against entropy. The enzymes, all this balanced stuff, you're going to die. You're going to die. The idea is not to get there in a hurry. Okay, and the idea is the body's supposed to work and work and work, burn bright, flicker a couple times and go out. If you're diabetic, you're going to lose parts for 30 years, okay? You're just going to drag. This is one of the big things with America. I mean, how huge is diabetes in North America? I mean, it's crazy. And you look at these kids. I mean, these kids that are autistic. I mean, when I was in school, if you were autistic, that was called mental retardation. You know, it's not politically correct anymore, but it's like 1 in 17,000 kids. Now it's 1 in 88. There's something wrong. Who's going to fund my retirement, you know, if everybody's autistic? So you look at this stuff, and it's scary. And you look at how this stuff runs, and you go, there's something wrong, but you got this corporate stuff that's at a huge level of Congress, where you got somebody in Congress, he retires, and now he's running the FDA, or he's a COO or CEO of Monsanto or some huge company, and nothing gets done. It's just going to get swept under the rug politically. But chiropractors have no clout whatsoever in Congress, because we don't have any money to buy a congressman. We can't buy one. You pharmacy guys own everybody in both pockets, and that's how it works. But we're on the outside looking in. But it doesn't mean necessarily we're healthier. Well, what's our deficit? 17.5 trillion. We're spending like $3 trillion a year in health care. But it's not even health care. So get over that too, because it's not health care, it's disease care. That's what frustrates me. If they would actually call it what it is, I'd be okay with it. But it's not health care. So what's the definition of health? Nobody can reach it, because Dorland's Medical Dictionary says health is complete social, mental, physical well-being, and not merely the absence of disease or infirmity. Okay, so nobody's going to make it. So what you want to shoot for is being well. So if you can be well, you're less of a drag on the system. You enjoy life. You get old, hopefully you die in your sleep. Okay? You don't want to lose parts and tax the system like crazy, because that's what's happening now with 300 million people, and it's going to crash. So we're either going to have to turn ourselves around and do something totally different, or we're not going to really probably make it the way we are. And they can bring our country down with an EMP, or they can take us down by just making us all sick. So one way or another, something's going to happen. Am I out of time? One more question or no? Oh, that one's too small. I can't read that. Okay. Have you heard that once a person... Oh, this is great. Okay. Once a person starts going to a chiropractor, you have to keep making regular appointments. True or false? It's like, well, I don't know. The people I see, they take their blood pressure pill every day, religiously. And the old joke is, how many times you got to see a chiropractor? Or what is it? How many chiropractors does it take to screw in a light bulb? Once, but it takes 26 visits. But... some people, I see some guys, I'll see them when they plant corn and when they pick corn. I see them twice a year. Now, I see some people I've taken care of for 20 years. I've seen them 200 times probably. But I basically say, well, what do you want to do? We're going to try to give them what they want. That's what they came in for. I try to match what they want. Some people, they want to golf again. Some people want to pick up their grandkid. They're a wreck. They got all this stuff going on. They don't care. They want to pick up their grandkid. They want to be able to drive to Vegas. They want to be able to do whatever. I try to match what they want. I say, oh, by the way, we can do this, this, and this. If they end up working with me, because they don't trust me, they don't trust anybody when they go in. But once I worked with them, I can say, hey, we can do this, but it's your option. So if I end up just being a Band-Aid, that's fine. Some chiropractors want to just like magically make you perfect. A lot of people don't care. They just don't want a migraine 3 days out of the week. They're okay with one. So they can deal with one. They just want to get rid of the migraines 4 or 5 days out of the week. So if they're a little bit better, they're happy. So I just try to give people what they want. But if you see a chiropractor, I say, this is our lifestyle. You can do this, and we can do supportive care, or we can fix you and release you. And when you fall apart, come on in, and we'll start again. I hope I kept you guys awake. You guys have been a good group. It was good question and answers. I hope you enjoyed my presentation.